Okay, I'm Debbie and I'm wanting to do an abdominal exam on you today. What the abdominal exam involves, it involves me having a look at the stomach and just examining the appearance and things I see. It involves some percussion on your stomach, so just some tapping, some gentle pressing and listening with the stethoscope. So are you happy for me to go ahead with that?
Yep, that's fine.
Okay, so what I need to do is I need to get you lying down and your abdomen exposed. So I'll just prepare the stretcher. And if you could just rest your hands across your chest, it would be great, or comfortably by your side. That's fantastic. Okay, so the first examination I'm going to do is just observing the abdomen. So I'm looking for colour initially. I'm looking for yellow, which could indicate jaundice, which would indicate there's something wrong with the liver. I'm also looking for scars from previous surgeries. Now I can see a couple of scars here which indicate there's been a laparoscopic surgery. So have you had a surgery at some point?
Yeah, I had a cholecystectomy.
Cholecystectomy, so that means the gallbladder has been removed. Any scars down in this right iliac fossa would indicate a probable appendectomy. I'm also looking for pulsation. Around here, if I notice pulsation, it could be the peristalsis of the gut. Which in very small people can sometimes be seen, or when there's a lot of activity. Pulsation here could indicate problems with the aorta. It could be an aortic abdominal aneurysm, and that is a very serious, life-threatening condition. I'd also be looking at the shape of the stomach, whether it's distended, whether it's concave, whether there's any obvious masses on there, perhaps tumours, and things like that. But all in all, it's a pretty healthy looking tummy. So the next thing I'm going to do is have a listen to the stomach, or listen to the abdomen. The first thing I'm going to listen to again is listen for that aorta. I should just be able to hear the regular pulse, but if I was to hear bruits, which is a real shushing sort of sound, that could be indication of a AAA as well. Round in the kidney areas, if I was to hear that could be some of the renal vessels. So I'm just going to have a listen. So I can hear a gentle pulse in the background there. Now I'm just going to listen now in the stomach. Now I'm listening for clicks and gurgles. Those are the sort of normal sounds I would expect to hear, and usually between 5 and 34 sounds per minute. If I was to hear prolonged gurgles, that could be an indication that the stomach is upset, or it's your typical stomach grumble. And a really active sounds with a lot of gurgles could indicate diarrhea. Now I'm just hearing just some gentle clicks, and it's all sounding pretty normal. Now if I cannot hear any sound, or there's an absence of sound, that would indicate a dynamic ileus, which is where the peristalsis of the stomach has stopped and nothing is able to go beyond that point. That can be caused by infection. It could also be caused by a blockage. Lots and lots of gurgles is indicating hyperperistalsis, which is normally a gastrointestinal upset. Okay, the next thing I want to do is to percuss the stomach. So I'm just going to use my fingers and I'm going to tap around. Now, what I would expect to hear is a higher tone called a tympani, and that just indicates air, or just nice open spaces in the abdomen. If I was to hear large areas of dull sounds, that would indicate that there is a mass underneath. As I feel around here where the liver should be, the sound has changed and I'm able to identify the edge of the liver, which is sitting just in behind the rib cage where I would expect to find it. If I was to feel large or hear large areas of dull sounds, could indicate a mass or a swollen organ, but I'm not hearing anything like that at this stage. Small areas of dull sounds is to be expected with fluid and feces already present in the gut. Okay, the next thing I need to do is to palpate the abdomen. So again, I'm going to start in the right iliac fossa. I'm just going to gently press on your stomach, and if you have areas of tenderness, if you just let me know. Now, if there were areas of tenderness identified, I would then gently press down in those areas and quickly release my fingers. And I'd be asking whether there was pain increase on the release or on the pressing in that area. Now, pain on release could indicate peritonitis, which is an inflammation in the gut, because by the quick release, it causes that quick movement of the intestine and it causes some pain. Now that could be, often you'd experience that down on the right hand side where the appendix is, but it could be anywhere within the abdomen. Okay, now I'm going to do some deeper palpation. Just what I'm feeling for now is some deeper masses, or feeling for some of the organs. So again, I'm going to start on the right hand side. And I'm just going to try and feel for the edge of the liver, which I can feel just below the rib cage. Now, I'm not going to feel the gallbladder because I know that's been removed. The pancreas is also in this area, and if that's inflamed, perhaps that could be felt around here. Towards the left here, if I was to feel a mass, it could be the spleen. However, feeling the spleen in the abdomen like this would indicate it's about 3 times its normal size, so not something we would want to be feeling. So I'm not feeling any masses or anything abnormal. Okay, I'm also going to feel for the kidney, so I'm just going to stick one hand behind your back here. I'm just going to push my 2 hands together. And I can't feel the kidney, but I can just feel just under the rib here where that base of that liver is. And I'm going to feel again on the other side for the other kidney. Again, I can't feel the kidney there. Okay, one of the final checks I want to do is again for the abdominal aortic aneurysm. So I'm just going to push down and see if I can feel that pulse. I should be able to feel a pulse, but it shouldn't be expansile, so I shouldn't feel it expanding or really pushing against my fingers, and I can't, so there's no sign of an aneurysm there. So that's the end of the abdominal examination. I'll just sit you up for a moment. In the abdominal exam I've just done, I have not found any abnormalities. But if I do find abnormalities, I would use what I found in conjunction with the vital signs of my patient, their presentation and their history, to guide my further course of action. An abdominal aortic aneurysm with the symptoms of the pulsing aorta, and especially in the presence of a lowered blood pressure, would be immediate cause for concern and would be considered a status 1 patient and would require urgent transport in the abortion of the rest of the examination. Pain on palpation in the lower right quarter of the abdomen in itself may or may not be cause for concern, but again, looking at the big picture, if I was to combine that pain on palpation with rebound tenderness, with a history of vomiting, and especially with an increased temperature, that would raise my concerns for appendicitis, and perhaps even advanced appendicitis. I'd probably consider moving that patient to a status 2, just in the event of rupture of that appendix, putting that patient then in a life-threatening situation. Pain in the upper right quadrant of the abdomen could indicate cholecystitis, which is inflammation of the gallbladder, or could indicate gallstones. Sometimes you may find that the pain radiates through the back to the scapula or up to the right shoulder tip. Pain in the epigastric region could simply indicate indigestion or reflux, but it could be an indication of other things such as pancreatitis, or it could even be an indicator of a brewing MI. The St. John clinical procedures have a red flag section for dealing with abdominal pain. severe pain, increased temperature, pain on palpation or movement, pain that radiates into the back, pain in the loins and flanks. If someone has missed their last menstrual period and is experiencing some pain, or if they are currently pregnant, and patients with repeated vomiting, raise alarm bells, and those are conditions or situations where a high index of suspicion should be used, and those patients will generally be transported to a hospital, at the very least a medical facility. It's really good to get a clear picture of what's going on with your patient. So just to summarise, using your signs and symptoms, your findings during your examination, your patient's history, their medications, just putting all those things together will help guide your course of direction and treatment for your patient.